San Antonio has one of the biggest populations of people who've served in Iraq and Afghanistan, and PTSD, of course, you've heard, is a major issue. A lot of people need help but don't want to get it because of a number of different reasons, and Dr. Alan Peterson is here with the UT Health Science Center. And you're in charge of a new PTSD study. And first of all, before we get to that, how big is this problem, especially here in San Antonio?
It's a big problem, especially with all of the veterans, Military City, USA, so we have lots of individuals. We think probably about 15% or so of the military, active duty, and veterans are at risk for PTSD.
And even years and years after the fact, after some of them have come back, say in 2004 or 2005, those deployments, they can still suffer some of the effects. What are some of those effects?
Well, it's re-experiencing symptoms, having nightmares, flashbacks, that type of thing. Avoidance, people avoid thinking about the trauma, avoid going to some situations that will trigger off the symptoms, and there's emotional and cognitive effects as well.
And this study that you're going through is partly because it's been tough to get treatment for all the people who need it.
Exactly. So the new study we have has got what's called cognitive processing therapy, and we'll be looking at regular in-office care versus delivering it through telebehavioral health like Skype into the patient's home. And the other arm, the third arm, is we'll actually send the therapist to the patient's home. That'll help avoid stigma, transportation cost, concerns about coming to a hospital or the VA or a clinician's office.
And you say normally, and it's different for each person, but in a setting for an hour at a time, 12 sessions can really help produce results.
Absolutely. This therapy in particular, when it was evaluated in a civilian setting, 80% of people at the end of treatment no longer met diagnostic criteria for PTSD, and they were still in remission 5 to 10 years later. Whether that will work with combat PTSD, we're not sure, but we want to see.
And they can get involved if you know somebody, whether you have PTSD or you know somebody who has it, and you want to encourage them. If they call that number 562-6727, there's also a control group, but either way, you're going to get therapy, right?
Actually, in this group, everybody gets the therapy, so there's not, the control group is the regular face-to-face in-office, which has been shown to work with civilians. The experimental is looking at going to the patient's home or doing the Skype version, secure Skype version to the patient's homes. Everybody gets good care.
And the main thing is, you say that they need to talk it out, the cognitive therapy, and shouldn't be afraid to, as we were talking about, poke the bear, to really bring up what's bothering them, to take them back to the battlefield even.
Right. There's talking about some of the things that happened is important, and the beliefs that people have about themselves, the world, the future. That's part of what's focused on with cognitive processing therapy.
Stuff they don't want to share with their husband, wife, parents, brothers.
Exactly.
All right. Well, thank you very much, Dr. Alan Peterson. Good luck with that study. And again, if you have any questions about it, just call that number right there or check out the UT Health Science Center for more information. Evie?